Welcome back, and we continue with our focus on COVID. Now, this is a very interesting topic that we're going to pick up because what is being discussed amongst the health experts, amongst the top scientific minds in our country, could actually bring about another big change in our vaccination policy. Even as we fight this pandemic, a large part of that really depends on what our vaccination policy will be. And as more and more studies get carried out to understand the virus, how vaccines are impacting it, how our bodies are dealing with the virus, the policies also keep evolving. So now a group of experts, the Indian Public Health Association and the Indian Association of Preventive and Social Medicine, have submitted their own views and recommendations to the government and written to the Prime Minister. Now, this is highlighting various parts of COVID management, but I want to focus on the vaccination part and the policy around that. Because these experts are suggesting that as of now, there isn't any dire need or hurry to vaccinate people who've already got COVID infection. There isn't enough evidence that shows that those who've naturally been infected actually gain much from the vaccine itself. So maybe for now, we don't vaccinate these people. They in fact also go on to say that our aim needs to be how to control this disease and the infection and achieve herd immunity in the best possible manner, the most efficient manner, which according to these experts would mean to continue focusing more on the vulnerable, the elderly, and to actually give them the vaccine, those who have comorbidities, not necessarily those who are young or even children. So to keep them out. Now, the government says we've got these suggestions, we welcome these suggestions because these are all great minds, and we're going to sit and discuss this, maybe have one-on-one conversations with them. So the government is open to changing its policy or looking at scientific evidence to say what should our policy really be. This is what the Niti Aayog also said today when we asked them about these views that have been put out. Specifically because it's big when you say that those who've recovered from COVID don't need to take the vaccine right now. Earlier, the advised gap was 2 to 4 weeks. Then we came about and extended that gap up to 6 months. Now, are we saying even after that you shouldn't and you should wait? Is it largely because we have very limited resources, which is where we have very limited vaccines? So let's focus on protecting the most vulnerable. Let's ask the experts who are joining us right now on this. Dr. Rajiv Das Gupta, Chairperson for Center for Social Medicine and Community Health at JNU. Dr. Virender Singh Chauhan, Emeritus Professor for International Center for Genetic Engineering and Biotech. And Dr. Sunila Garg, Lancet a member of the Lancet Commission and COVID India Task Force. Dr. Sunila Garg, let me start off with you, since you are a part of that group that's made these recommendations. What is the basis to say, for now, let's not look at those who've got COVID at some point?
Yeah, thank you, Tanvi, for having me on the show and asking me this very, very important question. Now, we are in a situation where, we are having, limited infections, but then also we have had sufficient number of people who have already suffered from infection. That is about, let's say, about 2.9 crore individuals. And this policy of the government came on 21st of May that we need to, space up the vaccination doses, basically to about, we need to look at that we increase the gap to about 12 to 16 weeks, right? So as of now, when we say that we need not vaccinate people who have suffered from infection, the basic logic is that we have to prioritize the vaccination rather than basically opening the vaccination to those who are, not susceptible or who are the ones who are not going to suffer from severe infections, particularly if I talk of children or I talk of younger individuals as well. That means I'm talking of 18 to 45, and particularly those amongst those who are not comorbids in this age group also. So, different studies have already demonstrated that, if the person has suffered from infection, then the antibodies are going to last for a period of 6 to 9 months. So as of now, when we are running, in terms of resource crunch. So we must prioritize our vaccination policy. That means we need to give to more who are needing the most. That means I'm talking of people between 45 years and above, people who are comorbids, elderly people and all that. And even to the lesser ones, the ones who are, suffering from comorbidities, because you see people who have already got the infection. We also have observed that people who suffered from infection in July, August and all last year, again have got this infection, but the infection has been much milder in nature. Something like the ones, if you get 2 doses of immunization. Also, another study which has been recently done has also shown that breakthrough infections are there to the tune of 11% in those who have received 2 doses, and also to the tune of about 20% who have received 1 dose after 14 days of infection. So it is a matter of prioritizing your resources. It is a matter of protecting the vulnerable, and it's a matter of getting the herd immunity basically through immunization, and also through them who have already got some immunity through infection.
Okay, interesting that you make that argument, Dr. Rajiv Dasgupta. Do you also agree with this? And if it is indeed about, if indeed we are saying that those who've already suffered from COVID and managed to fight it and recover from it, perhaps will get a second round which wouldn't be as strong, and so they can manage it. Let's focus on the elderly, let's focus on those with comorbidities. Then should this be age specific? Should this policy of not vaccinating COVID recovered be specific to certain age groups?
No, thank you. Essentially what Professor Garg is saying, and that's what this statement is highlighting, is a set of recent evidence, one published as recent as the last week of May in Nature, where long-lived bone marrow plasma for immunity lasting for at least 1 year, and another very large-scale study which is based on big data, not collecting samples from patients, but an analysis of big data from 2 data companies supported by the National Cancer Institute of the USA, that across 3 million persons, the incidence of reinfection, which means anyone who had a prior infection again getting it, is extremely rare. In a context where vaccine supply is limited, that is extremely crucial, that this is being advocated, or at least to be considered in a situation where vaccine supply is limited. That's what I would like to underscore.
Okay, I have a few questions, and I'll come to that in just a bit. But let me also get Dr. Chauhan's views on this specific recommendation. Dr. Chauhan, do you think it would be prudent to take the gap beyond 6 months to say not at all right now? Let's see when the availability of vaccine situation gets better.
Tanvi, it seems to me all this discussion is taking place in the backdrop of that we have a great paucity of vaccines. So imagine for a minute we didn't have any paucity of vaccine. Will this discussion be of any merit or not? I'm not very sure. The Nature paper, which has been just now cited by my colleague, is really talks about having the cells are still there, the B cell memory cells are there. I would be hesitant to say this or that until you did a study in India, large-scale study, and found out how long the immunity really lasts of the natural exposure. Now, suppose immunity lasts for X months or Y months. Is the after X minus some months, is it good enough? Is there enough neutralizing antibodies? So I also agree that the data is emerging. This is going to be changing scenario on the daily basis. But to say that those who have had infection, mild infection or serious infection have recovered from this, they should not get vaccinated, obviously is not on the table. They should get vaccinated. I just take it what we are saying, that since there are not enough vaccine, therefore we should tweak with our policy. I have no objection to that. But it's a leap of faith. They're saying that 6 months इंतजार कर लीजिए, 9 months we can wait, 1 year we can wait. I would, as a scientist, I would like to look at a hard data. If data from elsewhere is to be accepted, I would still like a lot of data being produced in this country, because things are different, exposure may be different, variants are different. So I'll be a little bit circumspect. But given there is a paucity of vaccine, one would go along with this that, of course, if there are hundreds of people are waiting to be vaccinated and 10 of them have had exposure, would I immunize the 90 in preference? Answer would be yes. But I wouldn't say that 6 months or 9 months or 1 year until you see good quality data.
So, no, that is what it is essentially, Dr. Sunil Agar. It's essentially trying to prioritize and streamline to say, well, let's protect as many as we can, as quickly as we can with limited vaccines, and then we go to the next group. Is that what it is, Dr. Gar?
Yes. So,
yeah, you can carry on.
no, I just want to say this. Remember, the number of people who actually have had COVID and recovered from it, that number is tiny. So these numbers, we can play games with the numbers. By government-owned data, there's only 2 to 3% people have got infected and recovered of the total population.
Yes.
So we're looking at a very large population which is exposed. So I personally really think it is not something we should really scratching our head about or ponder about.
So, your very valid point that you've made. Dr. Sunil Agar, let me ask you this question then. When we are, as per the government, going to be vaccinating 108 crore people by the end of this year, because we will have 216 crore doses, how does 3 crore as things stand right now, 3 crore COVID cases in our country, so 3 crore COVID recovered people, how does that 3 crore really make a big difference?
You see, right now, Tanvi, we are fighting for lakhs of doses. You're talking of 3 crore individuals. And then, that is one thing which is important. I said it's a question of prioritization right now. But you have got finite number of doses. And also, you see, with the report says that they will go down lower in the priority list. That is important. Again, anything which is very, very important is that why not I focus, or why, from the public health perspective, we not focus on the people, who are, most vulnerable to infection, or, basically, let's say, who will succumb to infection, who are comorbids and all. So that is one thing which is very, very important right now. Even, when tomorrow we'll talk that we lost 3 crore individuals because of this. So this is where, we have to look at that whole, that means we have to look at 3 crore more susceptible individuals rather who would receive the vaccine, and given that at the district level, that is going to make a huge amount of, difference. And as I say, basically, that right now it is the protection of the population which becomes very important. We don't have to have an individualistic approach. We need to have a community-based and a public health approach. That is what I'm talking. And as I said, priority will go down, but it is not that they are not going to, as somebody, as my initial, it was pointed out by Rajiv ji also, that, we need to look at what kind of resources today we have. The number one, this thing is that, and whether we'll be able to cover them completely. If there are 3 crore individuals who have received only 1 dose and they are more vulnerable, definitely it is better to protect them with 2 doses rather than, not giving them a dose at all. So that is where, these numbers will make a difference.
Okay, fair enough. So now we're being realistic. Of course, I would say that the government's claims and assumptions shouldn't even be factored in here. What you are saying is what it is. We need to be able to come up with a plan where we are at least able to ensure that all states have the second dose available for those whose time it is to get second dose, and it doesn't get extended, beyond what is already been advised. But Dr. Rajiv Dasgupta, the other aspect of these recommendations has also been to not prioritize or to not focus so much on the younger population, and that is not really a cost-effective policy that we are looking at right now. Would you go out and say as much that we need to perhaps again withdraw from this 18 to 44 age group right now and only look at those with comorbidities and the elderly, because that's all we have right now?
I think what really is the heart and soul of the statement is 3 words: evidence-based flexibility. And that's what Professor Chauhan, I believe, is also alluding to, that what is the evidence. Now, the point is, and this is what it runs into 5 or 6 pages. What it lays out in greater detail is actually to have a district by district strategy. We have been thinking in terms of a One India plan, but when we are dealing with a billion plus population, a One India plan is just not adequate given the diversity of epidemiological situations across the country. And therefore, this statement actually calls for taking the unit of planning and implementation as a district, which we all do in our everyday work, but to come out of a One India plan, mode into a district-based approach, and that's essentially the kind of flexibility that states have been asking for months now. I think somehow the impression went out that the states are only asking for a local procurement, which of course now stands reversed or corrected. But that wasn't really the essence of what states were saying. States were essentially saying that give us a flexibility of prioritization and allocation within the state elements or strategies. And that really is the soul here of evidence-based flexibility, taking into account several important factors and not just one.
Dr. Chauhan, what is your view on this? I mean, if we are specifically saying that we have a shortage of vaccines and that situation may not change in the next 3 months drastically, then should we look at also saying put youngsters in the lowest priority group? I mean, you can say it, but it's not happening on ground. On ground, what we are looking at is that private hospitals are managing to get a good share of the vaccines, tying up with the corporates, and we are using, thousands and lakhs of vaccines every day to vaccinate this working population.
So Tanvi, on an average per day average for the past 6 weeks or 5 weeks that I've seen, ranging from 20 to 30 lakhs.
Correct.
So let's settle at about 25 lakhs. Now, there are 2 issues here. One is that let's get the age group 45 to 60, get them because they are more prone, etc., more deaths occur in this. Again, this is really the constraint of the supply chain. But let's live with it. Let's agree to live with, at least for next 2 months. Last time when we had discussion on your channel, I said at least that June and most of July might see the same number of vaccine, but at least I believe, and you said that, yourself said that, but beyond July, our number of doses available to us should increase at least by 40%. Now, if you want to open your factories, if you want to open your production lines, then that age group is from 18 to 45, largely. So I suppose you could have a tweak policies between 18 and 25. You may have to, if you do too many layers of too many restrictions, I think you will be confused forever. So yes, above 45 and beyond, but in the layer of vaccine, hesitancy must not move into the water. We would not like to see that we prioritize, but then we find the vaccines are being either wasted or not being used. In that confusion, I think that should not happen. We should be very careful. I have no problem between 18 to 45. As Rajiv very rightly said, states can then quickly take decision, whatever they are comfortable with, and start vaccinating. I hope beyond July and early August, that's what the Niti Aayog representative said, that our supply chain would be augmented hugely. And some of the discussion that we are having may not be so important at that time. Remember, Europe and America and Canada are moving into below 18 now. They're already in the age group of 12 to 18.
Yeah.
And we need to move on. We can't use the current vaccine because the current vaccines have not been yet tried for 12 to 18. But I think that time to come, we have to open our schools. We have to open our university. That age group is desperately important. So I don't want to confuse the viewers here. Yes, if a state feels that between 45 above have not been vaccinated, they should prioritize them, get them vaccinated twice, and slowly move down from 45 to 30 and so on and so forth.
Yes.
Hopefully, the vaccine constraints will be removed and some of these discussions will not be valid anymore.
Well, that would be the most
Over.
ideal situation, and our hope, isn't it, Dr. Chauhan, that we get more and more vaccines. You rightly pointed out, in fact, the average in the last 10 odd days, the average that we've done has gone from 27 lakh per day, or to even up to certain days where we've touched 33 lakh per day vaccination. So we are looking at 10 crore doses this month being administered, and then from there on improving. But because the government said that they have welcomed these suggestions and they will be sitting down and having conversation, we wanted to talk about it and bring all kinds of views. And suffice to say, as I thank all the three experts for joining me on this conversation, suffice to say that these are the recommendations that are being made to largely put in a priority list. To say priority wise, your priority, don't forget, is still to give both doses to the elderly above the age of 60, and then to those with comorbidities, especially above the age of 45. And then you come down lower basis the number of vaccines that you have, basis the vulnerability of the various groups. Of course, the frontline workers continue to be your topmost priority. Then you talk about those people who have to step out more, maybe on a daily basis, and are more exposed or vulnerable to getting an infection. Vaccinate those. There is a view and a camp that believes that maybe you should leave this to the states to decide. But the states will also have to refer to experts for all of this advice. So is it better to just centrally have a larger thought process and policy in place that can then be best implemented by states on ground? That debate really continues, and we wait and watch what happens. Ideally, the best situation would be to just get more vaccines, but we have now learned that that's not going to be an easy process either. It will not be something that happens overnight either. Meanwhile, will the government look at changing the policy and prioritizing specifically certain groups? Again, we wait and watch. Thank you for joining us.